Hi, this is Vic Gatto. Thanks for tuning into the Health Storm. Super happy to have you here. Today I have a great guest, Chris Restle. He's the former VP of Emerging Markets from Healthgrades. Really strong at healthcare data, healthcare marketing, using marketing and data tools to help health systems communicate with their patients, with their customers, and help them get pulled in and sort of gain market share. He's been doing that for 15 years. We talk all about that and the trends in the emerging space, the storm coming, but then we also dig into using advertising techniques and tricks that we typically see in the TV and internet, getting us to do unhealthy things. Can we use those same advertising tricks to get people to change behavior for the good? Great show. Please tune in. I think you'll really like it. Chris Restle, former VP at Healthgrades. Thanks a lot. Hey everyone, welcome to the Health Storm. I'm Vic Gatto. I'm here with Chris Restle, former VP from Healthgrades. Chris, thanks for doing this today.
Yeah, it's my pleasure, Vic. Thank you for having me on.
Yeah, it's going to be fun. So before we really jump in, just give the audience a little bit about your background. You spent 15 years in and around data-driven kind of healthcare technology spaces. Just describe what that means and sort of how you think about the role.
Sure. Yeah. So about 15 years ago, I started working with a company called CPM Marketing Group at the time, and this is, they'd been in the space already for probably 10 years, and they would build CRM databases for hospitals, and they were pretty much the only company that was doing this at the time. And this is, when we said CRM, this is actually kind of like pre-Salesforce being everywhere too. So the definition of CRM was a little different, but the opportunity from a business perspective was that it was very common that a hospital might have multiple data systems. They might have their ambulatory clinical data on one system, the hospital on another. And it would, the example I would say is you could be a primary care doctor and you might not know that your own patient came into the emergency room. And so from a marketing perspective, it was very hard to send out meaningful communications because you just didn't know the big picture. So what they would actually do is build consolidated databases where they would take these multiple data sources. So you might have inpatient, outpatient, whatever it is, and it might be a health system too. I mean, 10 years ago, it was not uncommon that a large health system might have various hospitals on different EMRs. So it was really hard to talk to each other for these organizations, and it made marketing difficult where a hospital A might be marketing to people that thought were prospects, but they're actually patients of their other hospitals. So, there was a lot of reasons that this was valuable from a marketing perspective. So this type of CRM, as we defined it, was really all about seeing the big picture around the patient. And there's definitely consumer opportunity here as well, but really in the beginning, it was about seeing the big picture of the patient and understanding their full medical history. So the reason I was really excited about our talk is that one of the themes, as you know, we talked beforehand, that I'm looking at is the rise of the consumer. And I think this technology, this initiative that you started working on as one of the earlier folks, 15 years ago was pretty early in the trend line. It really, I think, is a kind of an artifact of sort of everything was centered around the physician, and the physician, and there was a payer, the insurance company was the customer, and of course the patients were around, they were being operated on, but and we now have shifted, or we're in the midst of shifting to the patient, the consumer at the center, and your tools sort of help to the health systems understand that and begin to work in that. Is that fair? Yeah, absolutely. It was really about understanding the whole person. So one of the things I was going to say is you'd have to be able to say this is all the patient records of Chris Restle, right? So you need to be able to say Chris Restle coming in over here, Christopher over here, whatever it is this is the same person. But then what I think is part of the secret sauce is third-party data that gets added in. So we would look at the entirety. So they'd bring in a bunch of demographic level information about the patient as well. So you'd be able to know things about their level of education, what language they speak, like just all these different things. And if we go back to the term CRM, customer relationship management, it really is consumerism in the earliest stages, because what you were trying to do is really, like, I consider myself a healthcare marketer. As a healthcare marketer, we know the best possible scenario would be that I'm here for you as a patient when something in your life changes and you have a health need that emerges, whatever that is. And there's no way that I'm always going to be there for you, like one-to-one, right? So to take a technology that can take these, previously in old school marketing healthcare was everybody got the same thing. If you're over a certain age, you're getting the heart mailers, you're getting everything. And those don't feel very personal. They don't feel like we have a relationship. And so if some other hospital and they're fighting over you, right? So if some other hospital had a way of being more, showed me some marketing that knew me as an individual, and the pictures on it looked more like me, the skin was my color, they knew I spoke Spanish, whatever that is, that level of information is the best we can do, if to show that there is a relationship there and to hold on to that patient loyalty.
Yeah, and so other industries have been doing this for decades,
yeah.
And health systems have been doing it now for 10, 15, 20 years. They've been sort of beginning this process. Is that fair?
Yeah, we in the beginning, we had to be very disruptive, and you had to, so the decision for CRM was often made up higher because it's trackable and you have a really granular sense of ROI. So from a leadership perspective, that's very attractive for marketing and very unlike what was done previously. But, we would honestly have to go into these situations where you'd have marketers who'd been doing it the same way forever. And now you got this fancy system that's going to measure them and tell you whether what they're doing is actually working. And if people are not just attending an event, but actually coming in and consuming services with the hospital.
Right. Okay, and then you had a kind of an interesting journey through there, very entrepreneurial, where you would be with a company and then sold it to Healthgrades, but then you also would break off, and you did that a couple of different times. Talk about that experience of inside, outside.
Sure. I started out with CPM, worked for them for about 6 years. I actually got recruited by another company that wanted to get in the space. And they wanted to develop their own technology platform, and they wanted me to be kind of the inside CRM guy who could kind of educate the company, do sales support, but also help them develop the platform. And it was a real learning experience for me, because that was the first time that I had gone from being because in the beginning I was very much a client-facing strategy person. How to use this system to achieve your marketing goals, and
versus create a system,
yeah. So I knew what I knew, and we had to kind of build from scratch, and it turned into the first time out was tough. The technology wherewithal required and the budget and everything was, I think, not something that the company was really prepared to do. So in that case, that lasted 3 years, and it didn't happen. And that's it's hard to get into the space. And what we've seen and what I've seen working with other companies like this, so I've worked with a few other companies in the space as well, that basically had the same basic plan. They wanted to get into the space that CPM, which was acquired by Healthgrades, they wanted to get into that space. And what we saw is there were companies trying to get in on a pre-existing platform, and often they were Salesforce, right? And I think the trick is, by that time, this Salesforce had really began to own the CRM term, right? And people are like, well, why don't they just use Salesforce in healthcare? And so obviously this is before Salesforce developed Health Cloud, and I don't think they realized it. Well, anyways, what I would say now is really critical, and the thing that I learned is really how we talk about it and how we talk about what we do and our product, and really educating these companies I went to work for is how do we talk about this so the customers, so the healthcare marketers understand what to do with it. And if we just say a CRM, they're going to stick their records in there and they're going to pull stuff out, and it's going to be a pretty simplistic use case in some ways. And the way that I began really talking about it is that I would describe it as a rules-based decision engine that can sit on top of your CRM It's fed by your EMR data. It's also fed by third-party data that helps you understand those consumers. And it also tells you about the prospects in the market with that consumer data. But the idea is that it's, like if I'm a marketer, if I'm a marketer and I sell, shoes online, they might have a fairly straightforward situation where I bought a pair of boots last winter and winter's coming up and they're going to start messaging me about those boots. But if I'm a healthcare organization, I can look demographically a lot like my neighbors, but my health needs and my family's health needs could be very different. And how to find people that are likely to need services and how to talk to them and how often to talk to them and what sort of events could trigger someone coming in or to need a service. Like there's, just a place here.
Let's give an example of like what orthopedics or cardiology or maternity. I mean, there are high margin areas that a health system wants to focus on. Give me an example of where you would come in and sort of help them understand that space and then market to that space.
Sure. So and I'm kind of going with like my ideal tool set, right, that I'd have. Yeah. And so the first aspect is just sort of understanding what the goals are. And if to simplify our conversation to say, okay, I'm the healthcare marketer. I want to grow cardiovascular services. We want to grow screenings, and downstream, we want to get more, cardiovascular business, more surgery, whatever that is. So the first thing you do is you look at the market and see, if you have access to market share data, you can tell, well, you've already got 86% of it, so it's going to be tough to squeeze more out of it. I mean, you can, but above and beyond that, the thing that I think that a good CRM is going to do, a good rules-based decision engine is really show you the at-risk population. And you can get very I would want to get really granular upfront in the planning of this campaign, because that's going to help us set up our goals. We're going to understand what the opportunity looks like, what the individuals at risk look like, and that's going to tell us how to talk to them based on their demographics and how they want to be communicated to. So we'd actually come back and really show them what the opportunity looked like in terms of there are this many people. I'd put it on a heat map. I'd say this is where they live. This is the type of communications that are going to resonate with them based on their age, gender, like how they like to communicate, how they use the internet, all that stuff. And so when we come into this and the point of like really trying to say, okay, your goal is growing this, here's a pretty comprehensive set of data telling us what the opportunity looks like, what's realistic, and then we can put together a budget and talk about, like if it's an omni-channel sort of marketing campaign, we're going to be able to, figure out, what's going to fit within the budget and what, organizationally you can achieve as a health system.
If done well, it really works, right? You can shift market share, it can drive more utilization to your platform.
If I could give you like one, like the magical element. So all the CRM companies, if you sit through a presentation, at some point they're going to say the right message, the right person at the right time.
Right.
And that is by
default. Right, and hard to do, right?
Yeah. Well, and I think it's even hard to understand. And I think the piece of it that people don't really get is the right time. And the word sometimes that I would substitute with the right time is need. Talk to me when I need you as a consumer. So I kind of walk people through an example because I think this really helps. And you can use a predictive model, and you can look at my previous medical history as a healthcare provider, and that'll give you some indication that maybe, like, as if I'm saying that I'm at risk for cardiovascular disease, but it doesn't mean that your message is going to be meaningful to me just because I've got a family history or something like that. However, my example is, let's say I'm out in the backyard, I'm playing soccer with my daughter who is way more agile than I am, and she fakes me out and I twist my ankle and I go into urgent care with like a sprained ankle. Before they even really take a look in seriousness at my ankle, they're going to slap a cuff on my arm and they're going to check my blood pressure. So what if all of a sudden during this ankle issue, they say, Mr. Restle, did you know you have high blood pressure? But what? No. So that's going to create a diagnosis code. The core of the EMR data being loaded into a CRM on a very regular basis is that the data updates all the time. And so you don't just it's not just Heart Month where you mail everybody now, or you email them, or however you target them online. But the point of that is that what the data can now tell us is that something significant changed in my life. And a good cardiovascular system, like CRM system, is going to be able to have these pre-built criteria that's going to say, oh, something changed. Now we talk to this guy. So my risk.
There's some kind of catalyzing event, in this case a sprained ankle, that has nothing to do with cardiovascular, right? Mm-hmm. But it focuses you on, you're in there, you get it, and there's a window of time, and if the CRM system, if the technology marketing system is able to hit me right then, I'm much more open to that message.
Right, because if you think about it, like I was high risk yesterday.
Yeah, the risk is no different, but your ability to understand it and to listen to the message is very different.
Right, so it's all about need, right? I need you now, talk to me now. Yeah, I'm ready to receive this information because I'm walking out of that urgent care, my ankle's wrapped up. I'm not even thinking about my ankle. I'm going, oh my gosh, am I going to have a heart attack? Am I going to have cardiovascular disease? What's going to happen? Yeah. So talk to me now.
So there are roughly 5,000 hospitals in the country in different states of development, different segments, some very large, for-profit, multi-site, some not-for-profit, multi-site, and some smaller. Out of that, how many have systems like this as a percentage? I mean, do they all have it? Is it 5%? What's the penetration?
I would have to give you a really confident figure, but I've heard somewhere I want to say like 50 to 60%. So what's interesting though is that there's been a real battle between companies to get out there and get those hospitals and those large health systems CRM business. What is happening now, and it's been happening for a few years, is that these initial contracts that were signed in the past 5 to 10 years are turning over, and these health systems are going back out to RFP. Like, we're not really happy with the system we have. We want to. So although there's a lot of these in place, I've been involved in the implementation of literally hundreds of CRM databases, and I've talked to a lot of people who have just said, it didn't do what we thought it would do. It's not like a magic ROI machine. Like, you do have to feed it like marketing campaigns for it to make people come in. And I think there was a lot of other companies that would basically hand you the keys and say, here's your CRM, drive yourself home. And it is such a complex tool that in a lot of cases, people really need the support. And if they didn't get that support, they're not going to succeed. They don't innately know how to achieve their business goals by suddenly have access to
so half of the hospitals in the country have systems like this, but not all of them, maybe not many of them, are really using it consistently, effectively to get the outcomes.
Yep. Yeah. I've the past couple of years, I was able to really get in front of a lot of clients that have these type of systems, and it's really interesting. The thing that I noticed now more than ever, I was specifically visiting ones that had systems that weren't really utilizing them to their fullest, and it was almost the identical story every single time. So if you think about healthcare is now, because of the rise of consumerism, they're recruiting marketers outside of healthcare. They're getting people from consumer goods and pharma and all these places.
From fintech, from automotive, from wherever,
Yeah. So I could look into these accounts and say, okay, so is there a new leader in the room? Yes, there is. Did you come from outside of healthcare? Yes, I did. Did you used to use Salesforce as an example for your CRM, or Sugar or something like that?
No.
Yes, I did. Do you consider this database here, this healthcare CRM, to be identical to your old one? Yes, it is. So that's how they're using it, and not necessarily leveraging all that data intelligence part of it, all the directional part that says who to talk to and when to talk to them.
Yeah, interesting. Okay, and then in the last little while, you sort of shifted to exploring what's called emerging markets at Healthgrades, which is not international, but not health systems, broad, new types of healthcare. Is that right?
Yeah. So essentially, my job at that time was just to try and understand and to build out, a plan for identifying new places where the same technology, the data assets, that essentially the base same techniques and everything could be applied to go into new markets. And, it makes a lot of sense. And they have like a slightly, their problems are a little different. What they're trying to do is a little different.
So like urgent care, ambulatory, diagnostic, things like that?
Yeah, I looked at all that stuff. Yeah, so from that side to specialty surgical hospitals who have very different, and so like if you're a regular hospital, your marketing can be very much fueled by the fact that you have you own your primary care doctors and their patients, and you can mine the data of the patients to find out who's at risk for stuff, and you hold on to the patient relationship, but you want to drive them into consume service in a fee-for-model world, right? You want to drive them into fee-for-service model. You want them to come in and consume services. It looks different, if you're like a payer, that type of thing. But when you're like a specialty hospital, it's like a orthopedics, surgical practice or something like that, where all you do is surgeries. You're not really interested in diagnosing people with joint pain and working with them until they come to the point of getting surgery. Your best customers are diagnosed and in a healthcare relationship with somebody across town. So in your case, what you do for marketing looks very different than what a normal health system or a hospital might do. Same thing. There's applications in pharma. There's applications in medical device. It's really interesting. I feel like that is where this is all going, and I think I was surprised at how a lot of these industries are kind of starved for data. I don't know what's going to happen, and I don't know what they're going to adopt. But I definitely was able to see that there's definitely some value out there for that.
Yeah. So that's a great summary of your background. So as you know, I'm doing this show called The Health Storm. And that's because I see on the horizon a hurricane-like storm coming to disrupt the $3.5 trillion health industry in the U.S. It's slow moving, like all storms. They're that big or slow moving, but it's going to be really impactful. And there'll be some areas that have disruption, and hospitals might close, and people could lose jobs. And then there'll be areas of opportunity, open areas where entrepreneurial innovators can come in and sort of fill the void. And so I want to just talk through there's basically 4 different trends that I see as contributing to this storm, to this big event coming. And I want to sort of talk through them one at a time and just get your thoughts on them. So we talked about the rise of the consumer already. The next one is kind of care moving out from the inpatient hospital to the community and to the home. So that you don't need to be in the hospital on a 4-night inpatient stay to get a new hip anymore. You can have an outpatient facility and be at your home. What's your thoughts about that? Do you see that as a trend for right now, or is it off in the future?
I think it's happening now. The interesting thing I think is, I think we had a previous chat, and the healthcare is slow to change as kind of a relatively conservative entity. Business model wise, they're not as quick to move because they're regulated, data is protected. The thing that I think how it'll happen faster is because these big time tech players are coming in, like the Apples and the Googles, and they are investing billions, and they have the ability to they have the willingness to take more financial risk.
Yeah. And
so I think that, and frankly, because healthcare is not doing it, that's where they see that's where the puck is going. That's where they're skating to. That I think is what's going to happen. And I do believe that, the big hospitals are never ever really going to, I don't know. I think in a big city or in an urban environment, you need a big hospital that has a dense opportunity to get different services and specialties. But I think that the kind of the big hospital in every town is going to, that's not the case. Obviously, it's not a big hospital in every town, but I think the ability to specialize, the ability as technology gets better at sort of assessing needs, and we can do more with a small, like a a smaller setup. I think there's going to always be room for these specialty providers, or like moving primary care into a retail environment. All those sort of things I think they're going to happen. I think they're going to happen relatively fast.
Yeah. So it's interesting you bring up the market, what I'd call market entry, from people that are, brands and companies out there are not traditional healthcare players. Apple, Amazon, Google, Walmart are just four that I'll throw out, to start with. I think they may certainly attack primary care as a starting place, partially because it's low-hanging fruit, right? It's needed. They can do it with their employees and then expand. Walmart is already doing it in their stores, and that is okay. But what's interesting about it is that, as you said earlier, the referral patterns out of primary care, then, those big tech brands control where I go next. Like, where am I going to get my stint put in? And it may not be go anywhere you want. They may have relationships that are, consolidating volume, driving pricing, driving better results, because that's what they do with everything. They drive efficiency and deliver better quality and lower cost for their consumers, but also for themselves.
Yeah. I mean, it's not a hobby, right? They're not in it for a hobby, and these are companies. I mean, it's great to think of them if they really want to disrupt healthcare and promote this wellness, but ultimately these are companies that in every other aspect are chasing profit like crazy, right? So primary care by itself is not essentially very profitable. So I'm sure that the carrot and the stick for them is the high value services that, like you're saying, that they could also control the referral patterns for that.
Yeah. So I've been thinking about the U.S. steel mill kind of innovation and dilemma that happened 15, 20 years ago, right? And the mini mills came in and were only making rebar, which was easy to make and very profitable, and they didn't do any of the complicated things that the bigger mills could do. Mm-hmm. And at first everyone just thought that was a toy, right? But they funneled off all the high profit, high volume business, and slowly the big mills couldn't survive anymore. And that's fact, right? And so I see that happening in healthcare. If you take all the knees, hips, and stents out of any big, multi-specialty hospital, all that high margin, high volume business disappears. And then you leave them the critical care, the ED, the ICU, the much more complex, less profitable, harder to operate things. And that's not going to be profitable. That's going to be problematic.
Yeah. No, that is, you're right. And I don't know. I'm curious to see, what you think, but what are they? I mean, because I'm sure if you see it and I see it, and it's not too hard to paint a picture, right? And your steel mill example is pretty good for talking about how that would work. But it's the same thing as even these little cherry picking specialty providers that do all the hips and knees and everything. That's the high value stuff, right? They do want to hold on to that.
Yeah, I mean, you can turn these data and marketing tools into specialty niche areas pretty easily. And it's easier to sort of really understand the triggering points and the catalyzing events in those areas. That's what entrepreneurs do. That's what VCs do. We take sort of an area that is under focused on, but really highly profitable, and peel it away. And so we have 86 assets in our portfolio that are doing various pieces like that. And I just see it as this huge change that no one's going to notice for a while, but the hurricane is right off the coast coming this way, and it's going to be impactful.
Yeah. No, we're on the same page there.
Yeah. Okay. So talk to me about timing. I mean, healthcare, you've been in healthcare for a long time. Timing in healthcare is really the thing, right? So in my mind, these trends are real. They're going to make a change. The question is it going to be 10 months or 5 years or 10 years? And how do you think about timing in healthcare?
Well, I think like as far as changes being made on a large scale, again, like kind of what I said earlier is that the hospitals and the health systems are going to be in a lot of ways slow to change. I mean, there's definitely a less of a tolerance for risk than some of these other new players that are coming into the space. I think that so when the Apples and the Googles come in and they can prove these models work, it's going to accelerate things, right? I mean, I feel like they're going to be playing catch up, but it's going to.
The question is like, will they pay attention enough to be even fast followers and sort of use their market brands and their strength then to be competitive?
Yeah, I mean, it feels like the awareness that I have of it is that they're out there, and these are companies that don't mess around, and they have a much more singular focus. I feel like they're gonna branch off. They're gonna be like, okay, we're gonna make this work, and we're gonna throw resources at it, and they have resources that not everybody else has. But then the change, right? Timing wise, it's similar to some of the other stuff I've thought about, which is the idea of. We look at again, back to consumerism and how healthcare changes. And so up until this point, and, we're still pretty much there, is like we treat things very much as like the Band-Aid when something goes wrong. And we look at the rest of the world model. Some of us do and say like, there's this big emphasis on wellness. There is some, so the 4 things to change in healthcare, I feel like there has to be some things happening at the same time. And one of them is raised awareness. So we talk about like the social determinants of health is a concept that is getting thrown around a lot now. And it really is saying it's not just that, I gave you the right medicine and told you to stay off your foot or told you to use the inhaler, but it's that you live in a place where you can't get healthy food. You live in a place where it's hard to sleep because it's really loud. All these other social determinants of health. And so this is getting, like I was at the HIMSS conference last year, and this was brought up quite a bit. And so they're trying to raise awareness from the healthcare organizations. And there's companies that are saying, just like CRM, just like everything else, I'll help you understand these people. This is a new data set. We can bring it in and help you understand them. And then not just understand them, how do you make it actionable? How do you help them? So for healthcare to change, so a few things have to happen at once. One is the raised awareness. But the other piece that I think is interesting is you have to also have the incentives aligned, right?
Yeah.
So,
right.
So if you're going to start,
incentives are not aligned. I mean, so if you pay by procedure, hospitals, they want to do more procedures.
Yeah, and so if we think about wellness, if we think about sort of a capitated model, we think about the onus being on the provider to keep me healthy and not just have me like run up charges for the insurance company or whatever. Then when you're doing that, change can happen. I feel like, but it's got to have those two. If they don't happen around the same time, I don't think it's a coincidence that they're talking about this now at the same time as they're talking about like capitated models and keeping people healthy and wellness, because ultimately. That there's an opportunity there. Again, there's an opportunity to understand.
So I guess I think healthcare is $3.5 trillion, right? So it's people throw around trillion, I throw around trillion. It's 3,500 billion a year, and so it's a lot of money. So I don't, as an investor, I don't really see it as sort of a global health market, right? So we look at Medicare Advantage as a different opportunity than employer-sponsored healthcare, and that's different than Medicaid. And so they have different dynamics. In Medicare Advantage, you do have reasonably aligned incentives, and so we can test things in that space where there is you could do a wellness thing or try to make chronic disease less expensive, keep people healthier longer. in the employer, like the commercial world, that you don't get paid there right now. So there we need to deliver the same procedure, more convenient, less expensive to deliver for the same, DRG rate that is being charged everywhere else. And so you have to innovate on different axes, kind of, right? But then it will eventually come together in 5 years or 10 years as you get this sort of cumulative effect over time.
Yeah, well, that's the hope. I mean, I think we know, like, if you're making, like, again, if you're getting paid by the procedure, your motivations are different. But if you're like from the patient or consumer perspective, that's the payoff for us.
Right. So I'm really interested in your experience as a marketer, because one of the things I've been trying to learn about is behavior change. So one of the beliefs I have is that if you're going to help people be healthier and help them manage chronic disease, one of the key things is they have to change their behavior. And I will have trouble giving you a pill to do that. I have to get you to sort of live your life in a healthier way, make better choices. And that's really hard. We have, as a society, been really bad at doing that because it's hard. People are not willing to change their behavior, or it's hard to change their behavior. And I'm the same way. I mean, I'm 15 pounds heavier than I should be. And I should have worked out this morning, but I hit snooze 2 times and I didn't work out this morning. So I'm no different than anyone else. But I'm interested in your thoughts as you've been in marketing, sort of one level away from advertising. And I see Madison Avenue and advertisers convincing people, convincing me, convincing my kids, convincing everyone to take action that's not in our best interest for some commercial purpose. And my question to you is, can you use those same techniques, that same understanding of human decision-making for a different purpose? Maybe use that same power for good to help them be healthier?
Yeah, I mean, the answer is yes, right? It's really about who's going to pay for it, right? Because the tools are out there. From the resources that I have in front of me now, working with a hospital or health system, as an example, then the best that I can do is to really understand the consumer, the patient, and then try it, like, really understand them, not just as like their previous medical history, but as a person, where they come from, where their family unit makeup, all that stuff, and then put and understand them in a way that's like, the missing part is you can have all the data in the world. If you don't understand people, and that's kind of one of the things that I really feel like I learned, is what makes me good at this is I'm a people person, and I can look at data, and someone else can look at data, and they say, this is happening. But it doesn't say why it's happening. Why something is happening is because you understand people. So in terms of changing behavior,
there's all the graphics, right? So let's talk about that. There's demographic, psychographic. How do you think about those different ways to understand a person and maybe define those terms? Or how should my audience think about this science and this technology, this way to do it?
Well, it's kind of our kind of science, in my experience. And you have data in front of you. I'll give you an example of something it's interesting. I was working with a client, a healthcare organization, and they were trying to promote prostatectomies for men. So the prostate exam. And so we had predictive models, and we knew men of the right age that were their patients, and we knew that the data could tell us they haven't yet had their exam, they were due, and we could even say these are the ones that are at higher risk, and we should prioritize these guys and talk to them more often.
Yeah.
And we'd been running this campaign for a couple of months, and my client said, I think we got to cancel this. I mean, we'd probably already talked to 5,000 people. And I said, what's the deal? And she's like, we've only had, and I'm going to make the number up because it's been a few years now, but we've only had 17 men sign up for this, or something along those lines.
5,000?
Yeah, I said it was a really
Whatever,
low
I mean,
number.
roughly, it was very low.
Yeah, it was a low number, and she's like, I want to cancel it, and I said, yeah, it's not working. I said, before you cancel it, give me a week. And I went back and worked with my data team, and I had them pull, like I said, of those 17 responders, I want to see a demographic profile of them, which tells just status, like age, they're all men, so not gender, ethnicity, whatever I can, and then I'm looking for patterns. And that's what you're doing, is you're looking for patterns. In this case, what I saw, and it might have been 30 guys or something like that, but the point was, if there was 30 of them, 28 of them were married. And I'm like, well, I get what's going on here. And the piece that, in this case, we were actually, I don't think we had an email, we were direct mailing, this was a few years ago. And the piece said, Chris, it's really important that you have your prostate exam, call this number or go to this website, make an appointment, that type of thing.
Yeah.
And I looked at this and I'm like, their wives are.
Yeah, the wife is pulling it and.
I said, give me one more month of this campaign. And essentially what I said is, I want to look in the data, and we'd been personalizing these pieces so they came to the man's name, right? John, come and do this. So I said, look in the data. If it shows that they're married, I want to send it to Jane. And instead of saying, John, it's really important, I want to say, Jane, it's really important that John does this.
Yeah.
And so we actually targeted the wives to get the men to do the thing. And when we did that, the results went through the roof. Yeah. And previous to that, I don't, like just talking to other people in the household, you essentially would only do that for parents of little kids, which is, you also should do that with men and women. But in that case, so getting back to the data that's available, it is like art and science. In that case, it's looking for patterns and then knowing people and being like, and it was, honestly, it was a guess on my part, right? Like, I'm married. I know that my wife will help me do these things that I should be doing. And meanwhile, the single guys.
That's where the art comes in. It's an educated guess, and then you test it, right?
Yeah. That's all you can, that's all I can do. I'm sure ultimately you can build.
Selling cars like that forever, right?
Yeah.
I mean, you buy a car because this beautiful woman in the ad, clearly will date me or think I'm sexy if I'm driving this car.
Right.
So advertisers have been using aspects of that for a long time.
Well, and getting back to your thoughts earlier about the idea of modern advertising now and all the things that are around us that are trying to get us to do things, there's no reason that we should be going to a fast food restaurant advertising during the Super Bowl that's selling food at 2 a.m. that's covered in powdered cheese. There's just no good reason for that, but they're building a lifestyle, like where you're like, it's the same thing with the Corinthian leather in the vehicle and everything else is like, yeah, if Matthew McConaughey is driving that SUV, I think I'd do pretty well in there too. And you want that happiness, and it's all about the feeling people are getting. So
we need to be. I think we can align incentives to bring that to the health area, right? Like particularly in Medicare Advantage, there's financial incentive to have me sort of attract the right people and then keep them healthy. But we haven't made that transition yet to really take those techniques and those people, that experience, like you and others that can really help build that lifestyle brand around health.
Yeah, and I think it's desirable. Like we are, in the meantime, we're getting people to eat garbage, but at the same time, we're also in love with these, like these superhero-looking people, and ultimately, our health in our bodies and our longevity, it's not going to lend itself to the fast food side and all the other stuff. It's going to be over here. It's
right.
It's not binging Netflix and having pizza delivered to your couch.
Right. That's right. Yeah. Tom Brady's not doing that. He's doing other things. Yeah, so. Okay, great. Anything else that we should have covered? I wanted to follow up with two other questions, but talk about these trends. Anything else you wanted to cover that you didn't?
Well, I just think the thing that I'm interested in right now, it is still about the data, but it's the, and we all hear the statement that we're the human race in general, but especially us, we're generating more data every year than, in previous billion years or whatever the thing is because we have these things, right? So we have all these devices that are generating so much data. And the trick right now is that stuff, like this, my watch is and my phone are telling me how many steps I took today. It can tell me my heart rate, I think, all day. I don't know what good that is. And so we're trying to give this to our doctors. Like, hey, I want to load this into my portal, like my chart or whatever. And the doctor's like, great. It sounds good that you did 10,000 steps today, but it's not, I can't tell you how good. Like it's not meaningful right now. It's just.
We haven't gone from data to insight right now. We have tons of data, but we haven't been able to leverage it to give us insight.
Yeah. And so what I believe is the next big step is instead of these like a CRM database or these other, I mean, there's all these companies like that are basically doing the same thing. They're all exporting that encounter level data in, and they're just looking at it with different lenses. So population health's doing it over here and looking at risk groups, and marketing and business development's looking at over here. There's all these different people. What we're talking about now, I think, is like these data lakes or a CDP, which is a consumer data platform. And I know that it's going to be really big. And essentially, like a CRM database is what I would call, it's all full of structured data. We all know the fields. It's very mapped out. It's very defined, and we know where to look for stuff. Meanwhile, like the stuff coming out of our personal devices and our watches and those rings that measure your sleep, all that's going to be unstructured data because right now we don't know what to do with it. And so we make these big data lakes. And instead of you as a healthcare organization, maybe the chief technology officer, a CIO, instead of going out and buy, like just sending data out to all these different vendors, partner companies, to build the data lake and to put all that stuff in there and then be able to insert the tools, those different lenses, into there to do the analysis. I think that's where we're going next.
Yeah. I think that's a huge opportunity. I was talking to a data scientist this morning about using data science to take this qualitative data and infer insights out of it. It's pretty early days, but that's exactly right. We look at something to invest in that space.
Well, I mean, if you could, so basically, if you can tie outcomes, so if you have encounter level data that say, this is the type of healthcare this person has received, these are the diagnoses they've had, they developed this, and this, they've had these joint replacements, whatever it is, and then you can tie it to, over time, your steps and all this personally generated data and all, there's a ton of stuff. Like I think Uber and all these transportation companies, they're generating data about how far people are going and where they're coming from. Like there's so much data, and you just don't know until you juxtaposition these sort of pieces of analysis what you're going to get. But
you don't know what's going to have significance until you run it longitudinally and look at it.
And you kind of got to go in a little bit blind at first and just say, we're going to do this.
Yeah, we're just going to put it all in and then see what's impactful.
Yeah, I think it's really exciting. That's what I think is really exciting.
Yeah, interesting. Okay, and then the last question I'm asking everyone is, so you've been doing this around health data and healthcare, marketing, CRM for 15 years. What do you wish you knew at the beginning that you know now?
Man, I think it, we often don't get out of our comfort zones right away, and we're a little cautious. And this is a personal perspective, right? But sometimes, you get forced into situations where you got to get out of your comfort zone.
Yeah, and that's where you really grow, probably. Yeah.
Yeah, and so for me, it's always been these situations where it's sort of like desperation followed by getting out of comfort zone followed by growth. And so I've had some situations where, certain aspects get out of my control, and you have to say, okay, what's next, and how do I do this? And that, and so that for me, that is really translated to kind of taking control of what I want to do. And so in my case, like I had an opportunity where I was able to go to a company and just talk directly to the CEO and tell him my thoughts about what he does and how it could improve and where they're missing an opportunity. And it turned into an almost instant job, and it was really fulfilling work. But it was like one of the first times where I just went to somebody, and then I realized they don't need to be like offering me a job. They don't have to be advertising a job. And so I've had a lot of roles recently where I've gone in and they're like, okay, what do you want your job title to be? Okay, that's what it'll be. What do you think you do best? And I tell them, and then we transform companies. And that's the thing that I really realized that I like and enjoy is helping companies in some cases understanding who they are. And being able to say, like, if you position yourself this way, if you learn how to talk to yourself, and a lot of them are, we have a technology platform, we want to take it into healthcare. We can do this already, but we know it's really weird over here, and we don't know any of the nuance. So to be able to go in there and help them do that it's fulfilling. It's really great work, and it uses all my brain. That's what I like.
And it sort of broadens your skill set, and you learn as you do it. Yeah.
Every time.
Yeah, great. Well, Chris Restle, thank you for doing this. It's been really fun, and I will get this put together, and we'll see how the storm rolls out.
Vic, I look forward to hearing back from you, and great talking to you. Thank you for having me.
Okay. Thanks, Chris. Have a good day.
Bye-bye.